Okay, so we're going to do 6 exercises now. The first one we're going to do lying on our backs. We're going to take the left leg, bad leg, place the flannel underneath it on your slippery floor. This leg nice and straight, this one nice and aligned, foot, knee, hip, and lying on your back, you're going to just slide the flannel back towards your buttock as far as you can comfortably go. Take it right to the limit and then slowly straighten it as far as you can comfortably go again. Just remembering you've got to be able to draw it back towards your buttock again, so don't go overly past that if it's sensitive, because you might not be able to activate it to bring it back towards your buttock. Do that nice and slowly, going outwards and nice and slowly coming back, nice and controlled. And I would aim first of all just doing 5 of those and then have a little rest and then do it again and again, so 3 lots of 5. And we can up that as soon as we're finding that that's too easy. With the second exercise we're going to do, we're going to use a rolled up towel. Again, we're going to place it under the sore knee and we're going to lay on our back and we're going to contract this muscle here. So lie nice and straight again through the whole body, and you're going to just contract this muscle, so tense it, which is going to push the knee into the towel. And I want you to do that 10 times, have a rest, and then do 2 more sets. So again, 10 times 3. The next one we're going to do, lying on your side, again you can put a pillow under your head if you want. You're going to have the bad knee up, straighten the bottom leg and the top leg, and you're literally going to lift the leg up like this and gently lower it, nice and controlled up and down. Do stop this one if it's too advanced, and I want you to aim for 5 of those and 3 sets again. Now the next one we're going to do, I'm going to look the other way, so we're going to have bad knee down. We're going to bend the top knee for some stability, which you can probably put behind actually, and this time you're going to lift the bad leg again towards the ceiling and slowly lower and lift and lower, lift and lower, and again just trying to keep the rest of the body as straight and not twisted as possible. And I want you to do that nice and slowly again, and you do it 5 times and then again 3 sets. Okay, so for the last I've just spun around so that you can see the left leg again. I want you to put your heel on the ground like this, and you're going to be pushing into the ground for 5 seconds and then relaxing. So you're going to lie down flat, nice straight back, pillow under your head, push into the ground with all the force going through the heels. Your body shouldn't sort of come up. This should all be engaged and flat to the floor, but I want you to actively push the heel into the ground and do that for 5 seconds and then relax and then do it again. And you're going to do that 5 times, then have a little rest, and then you're going to do 2 more sets, exactly the same, 5 times in each one. Now the other one you're going to do is going to be a little bit challenging, so if it does aggravate, please do stop. Again, lying on your back, you're going to straighten both legs out. In fact, bring up the good leg, bending the knee, and then you're going to engage drawing the belly button in towards your spine again to keep the stability in your pelvis and lower back. And you're going to lift the leg nice and slowly towards the ceiling, and then hold it for a couple of seconds before lowering it down towards the floor again. And again, lifting up towards the ceiling and down towards the floor again. And I want you to do this one 5 times and 2 sets. So 5 times, rest, 5 more times. Again, if that is sore, please do stop. We may need to leave that one off for a few more days. Afterwards, you might find you've got some tension spots again, so you can use the roller, self-massage, coming up through the leg. You might be surprised what you find if you do give it a little rub down, so worth doing anyway. Also using a ball, a trigger point ball like this, a tennis ball, anything similar. You can use that in any of the muscles if you're finding it more difficult with your thumbs or getting there. You can quite often get a good bit of pressure, and you can control it yourself as to what you can tolerate. It should not be agony, it should be sensitive. I'd say 3 out of 10 maximum if we were going to rate the discomfort. But really we just want to press those tender spots and melt them away rather than create any significant pain. If you are finding the knees feeling a bit sore after the exercises, again, get the ice pack and calm that down. We do want to try and push through the boundary and get some strength there, but we don't want to re-injure the knee.